So I'm going to talk today about a topic that can be difficult for some people, so I warn you in advance that you may see yourself in these slides or see your own behavior in these slides. And I will say that I don't think most people try to harm people with obesity by stigmatizing them on purpose. I do think it is often kind of society that says it's okay that we make fun of people with obesity or give them a hard time. Just to warn you in advance that at times this presentation could be difficult for you. I'll try to share some of my own examples to help to lessen that, because again, I don't think this is about trying to say, hey, you're doing this wrong. This is about trying to improve attitudes towards people living with obesity. And really what I mean is, if we were here talking about cancer today, I think we would all agree that cancer is bad, but we have compassion for people with cancer. But kind of in our rush to deal with the obesity epidemic, we've decided that obesity is bad, and actually I do think obesity is bad, but somehow we've made the people with obesity bad as well. And I think that's a problem, and I'm going to prove that to you in the data today. And if we really want to tackle this issue, we have to understand the impact that bias has, and then if we can reduce bias, I think we'll actually have our first real chance on trying to address the obesity epidemic. There we go. My disclosures, nothing particularly relevant here. Here's the outline. Let's just dive in. So why is understanding bias so important? It really keeps people like myself who live with obesity from seeking help, and it keeps healthcare professionals from offering it. It is the last socially acceptable form of discrimination. I think we heard that mentioned this morning. In fact, unless you are from the state of Michigan, your employer could fire you today because of your weight, and that would be perfectly legal. We do not have protected status for people who actually have larger body size or even smaller body size. It does hamper our nation's efforts to effectively combat the obesity epidemic. No one thinks we need to do anything, right? We don't need to make the environmental changes that others here at this meeting have suggested, because you know what? People just need to make better decisions, and it's much more complicated than that. That idea that this is just about personal responsibility is bias in my mind, and we need to overcome that. It is our primary driver around the lack of access to treatment. So those of you that are clinicians often know that if a patient comes to you and wants to have their obesity treated, oftentimes those services aren't covered, or if they are, you have to jump through more hoops than any other therapy you've ever tried to seek before. And in fact, we see some horrible language written in people's insurance policies that obesity is considered cosmetic, and it's not covered under any circumstances, even if medically necessary. That's actually in my own insurance policy. In fact, for no amount of money can I, in Tampa, Florida, buy insurance coverage for my 11 employees that includes obesity care. Right, and that's a problem. Now, there are lots of other much more forward-thinking insurers in other parts of the country that do cover these services. I don't want to use my example as the only example, but I would say it's probably 50-50, right? It's probably a 50-50 chance on whether or not your employer or you as an individual could actually buy insurance that covered obesity care. And that's all aspects of obesity care, from getting counseled all the way through having bariatric surgery, and there's lots of steps in between there. I also think it's really important that you look at yourself and look at your own bias and what assumptions you have about people with obesity. And the thing I'd like to remind you is, if you're walking down the street tonight, and we're in Louisiana, they have one of the highest obesity rates in the country, and you see a person who weighs 400 pounds, I would ask you not to make an assumption about their health or their behavior based on their size. Because you don't know if they've done something remarkable in the last year, and actually they used to weigh 500 pounds and they've lost 100 pounds, which is statistically near impossible, but people do it, and there are people probably in this room who have done it. But us making an assumption that they're unhealthy or they're engaged in poor habits is one we shouldn't make. If you don't know the person, you shouldn't make any assumptions about their behavior. And that's important. So we have to stop and think every time we have one of those thoughts in our own minds. And that's what this presentation is about, is to get you to think about any assumptions you might have and actually show you why those assumptions are reinforced. And I'm going to show you lots of data about that as well. So I keep talking about bias, and so what is it? It really is just these negative attitudes we have towards people with obesity. It could lead to worse things, which are stigma, rejection, prejudice, and the outright discrimination that I mentioned earlier. It can be verbal, it can be physical, it can be relational, it can be cyber, it can be really subtle. I'll show you, and then I'll show you some really overt examples since that's what this presentation is about. It also could be real or it could be perceived. I think it's important that you understand this, and I'll use my own case history to share this with you. So when I was 20 years old, my girlfriend at the time, now my wife for many, many years, we're going to celebrate our 25th wedding anniversary next year, said, Joe, you have to go to the doctor. You have to go to the allergist. You have these terrible allergies. I'm tired of your asthma and all these other things. And so I went to the allergist. And the nurse is skin pricking my back to see what I'm allergic to. And the allergist himself walks in. He takes a peek at me, wags his finger. You could lose 20 pounds, turns around, walks out of the room. First time a doctor ever talked to me about my weight. By the way, everyone remembers the first time a doctor talks to you about your weight. Anyone in here who struggled, you remember that conversation too. But I mentioned the real versus perceived thing earlier is because then I perceived from that point forward, and it was about 14 years after that point, before I actually sought care for my obesity, that I perceived that every healthcare provider was going to treat me the same way that healthcare provider did. And I delayed getting the help I needed because of that. My story wasn't too bad, just a finger wag, right? But it affected me personally. There are people in this room, I guarantee you, have had much worse experiences than that, and it affects them just as deeply as well. So remember, it might not be you as the healthcare provider who has stigmatized the patient. It might have been a previous healthcare provider. And in fact, one of the most effective things I've seen healthcare providers do is actually start off by apologizing to their patients for the previous mistreatment they've likely gotten about their body size. It works really well. And in fact, there's a group of providers who are actually writing a paper about their technique using that. Hopefully we'll see that in the near future. Here's some of those examples of bias, because I told you I'd show you some overt ones. And since we're here talking about food at this conference, I'll pick on the one there, the Save the Whales, Lose the Blubber, Go Vegetarian. This is from PETA. This billboard was actually a real billboard. It was in Jacksonville, Florida, a couple hours from where I live in Tampa, Florida. And PETA put this up assuming or saying that they were trying to encourage people to go vegetarian. So I happen to believe a vegetarian lifestyle may benefit many people with obesity. However, I guarantee you not a single person went vegetarian because of this billboard. All this billboard did is teach children in Jacksonville, Florida, to refer to women of larger body sizes as whales. And interestingly, this billboard was up for about a week, when out of all shows, the Montel Williams show, I was asked to debate the CEO, my equivalent over at PETA. Her name is Ingrid Newkirk, and either a hero or a terrorist, depending on your political views. You probably can guess what mine are. We had this debate about the billboard, and she, of course, talked about, we weren't meaning to harm people. We were just trying to encourage people to go vegetarian. I said, well, you are harming people by doing this. And at the end, she agreed to take the billboard down. And then if you've ever watched Montel Williams, he did like this 3-minute soliloquy on how two people with very different views could come together and reach the right decision. And this was such a positive aspect. We were going to benefit society because of the changes we made. I guess Ms. Newkirk didn't like that, and I didn't put the slide up, but the next day, the billboard was down. It was a solid black one now that said, the billboard's gone, and so would be your blubber if you had gone vegetarian. So stigma exists. Now, this is really an overt way of doing it. But this idea that we blame and shame people about their weight is the problem. It is hurting people, and I'll show you more and more about that moving forward. So here's why it's a priority. There are millions of people with obesity. Therefore, there are millions of people affected. It has consequences. I'll show you the data around that, whether it's psychological, social, or economic. It really affects physical health. It reduces a person's quality of life. And in fact, if you're a young person with obesity, you may not have developed any of those cardiometabolic conditions we talked about this morning yet, but it is likely stigma that is actually the worst part of living with obesity, the way you're mistreated by your peers and by your family. And of course, as I mentioned earlier, it really does hinder our ability to develop a policy to address obesity and create access to treatments for obesity. This is a really odd slide. I'm not going to use my pointer a whole lot here, but I'll use it for this slide. This slide is odd because it compares discrimination. So I find it a little bit of a weird thing that you want to compare discrimination, because all discrimination is wrong. But I just wanted to show you how prevalent weight-based discrimination is. So if you're a woman, the most likely form of discrimination you're going to face is your gender itself, right? No surprise, ladies, right? But look here. If we take all the other forms of discrimination, The second most likely form of discrimination you're going to face is your weight. Gentlemen, we're not nearly affected across the board, except in a few categories like race and appearance, but with weight, we are not nearly as affected. I'll show you that throughout this data here. And here's this data looking at it in a different way, which is basically by class of overweight or obesity. And you can see there with gentlemen, it's not until they reach severe obesity, which is having a body weight about 100 pounds or more overweight, that they start facing any kind of real levels of discrimination, with about a quarter of them facing that. By the way, you'll notice I don't use, this is measured discrimination, yes sir. And so this discrimination, about a quarter of men face it. And by the way, severe obesity, some of you may not be familiar with that terminology. I mentioned 100 pounds or more. You often hear the term morbid obesity used. We don't use that term. We consider that somewhat offensive, and actually the patient population considers it very offensive. It's used by the surgical community primarily, trying to work our way out of that and starting to use the word severe. But I think more importantly here is this data for women and how vulnerable they are to discrimination. Look how early it starts, just in the overweight category, which is usually less than, carrying less than 30 extra pounds, right? And then in obesity, 30 to 100 pounds, and then in severe obesity, nearly half of women are facing some form of discrimination. And so why is this? Well, we see just about every single day that it's okay to stigmatize people because of their weight. We reinforce that it's okay to have this kind of bias. And I'll show you some examples of that by tackling a couple of these topics. We won't go through all of them, but just a couple of them. So one of my favorite ones to look at is the media. So what do we think about the media in general? TV, news, television, movies, radio, whatever it may be. We see portrayals that are stereotypical, right? You see this kind of the fat jolly guy or the lonely fat woman kind of thing. You see those kind of portrayals. There are people with obesity, but they're often ignored. There is this reinforcement of the social acceptability of bias, right? It's still okay to joke about fat people. It's not okay to joke about any other group of folks anymore, but it's definitely okay to do that. And in fact, if any of you watched the Jimmy Fallon and his show, a couple weeks ago, they had Jay Leno come back on the show and do an angry man rant about childhood obesity, where he suggested that we, instead of putting kids with obesity in their car seats, that we actually tie a rope to them and force them to run behind their cars, their parents' cars, as his solution. And again, interestingly, our current group of late night hosts do a little bit of better job staying away from fat jokes, but I'll show you another example from David Letterman later on, where kind of our last generation of late night show hosts definitely like to use these fat jokes constantly and over again. It really does affect people's perceptions about obesity, okay? You hear these jokes, you're more likely to repeat it. You think this isn't a serious problem when we're suggesting the solution is dragging a child behind a car, right? That's not a real solution to addressing obesity. And if we actually look, and there's been lots of studies looking at TV and film about how people are portrayed, there actually are few characters with obesity on television. There are some notable exceptions. We'll talk about those. But the characters on television are very stereotypically portrayed, right? They're lazy, they're evil, they're unattractive, they're cruel, they're unpopular. I'm not surprising you with any of these things. I think as you think about how people are portrayed on television, you probably recognize that. And there are few romantic social interactions or positive social interactions in romantic relationships. So two notable exceptions. Anyone ever watched the show Mike and Molly? Okay, featured two characters, both with severe obesity, engaged in a romantic relationship. Interesting show, kind of had a love-hate relationship with it. It played into some stereotypes, but it conquered others, which is kind of what we see in most of television and movies when I talk about addressing obesity. But did you know when that show came on the air, thousands of people wrote to the television network saying they didn't want to see two fat people engaged in a romantic relationship? Think about that. People took the time to write a television network about two fictional characters on a show that they didn't have to watch, of which there are 400 others on at the same time. But again, it shows to you how much in our culture it's become that obesity is bad, but so are the people that have it. And we've got to overcome that. And I think one of the most interesting ways that we're trying to overcome it is actually working with Hollywood to say, can we have more real portrayals of people with obesity? And I can't claim credit for our work driving the other example I'm going to give you, but it is a perfect example, and that is the show This Is Us. And if any of you have ever watched that show, and I do not, my wife watches it, and many of my members do, they say it is the most realistic portrayal of someone living with severe obesity that they've ever seen. They move beyond just the person is a target of jokes and actually deal with the real underlying issues. And to me, that's progress. So I don't want this to come across to say that all TV is bad, because we see progress. And in fact, we met with the Creative Coalition in Hollywood, which is basically the charitable arm of the screenwriters and the directors and things like that. And they gave us a whole list of shows that are actually trying to deal with this in a more realistic and fair way. And so we're excited about progress. But the reality is that we usually make a step forward and then half a step back, and there's a long way to go with how people are portrayed on TV and in film. And it probably doesn't surprise you, because I've already said it once before, is that bias increases if you see it, right? If you see bias on television, or you see a joke on television or in a film, or you read it in a magazine, or you see it on a video game, you're more likely to repeat it, and therefore that makes bias worse, right? No surprises here, just common sense. But we need to recognize the more you see bias, the more likely you are to engage in it. Now, does our friends in the news media do any better? So I would tell you right now that if you pulled out your smartphone and you went to Google News and you searched under Google News, you searched obesity, in the top 50 stories, I guarantee you'd see one of these 9 images. This is how obesity is portrayed in this country. People are headless, eating poor quality foods. It's focused on a body part, and they're almost always sedentary. The headlessness thing is my pet peeve. Why do we portray people with obesity without heads? Some people argue it's about privacy, but I still know that's my body if that's me that's being shown right there. And most of these are stock photos, and you've actually signed your rights away. They can show your face. And in fact, it's not just me who noticed this, and I'll show you some data about it in a little bit, but any of you ever read the satire site The Onion? So when obesity rates hit 35%, so this had to be about maybe 6-7 years ago, because we're at 40% now, unfortunately. The headline was, obesity rate is now 35%, headlessness 100%. Because they recognize that this is how we actually portray people with obesity without heads. And here's another example I just wanted to show you, and we'll pick the one on the right here, which is this ABC News story. It says, scientists discover a gene that controls obesity. First of all, there's not just one gene. I think they've discovered hundreds right now. It's actually some very interesting work being done in that space. Someday we'll actually be able to genotype people and actually be able to decide what treatment is best for them based on their genotype. It's very cool work. By the way, some people are selling that right now. I don't think the data is quite there yet to make that a truly data-driven or evidence-based decision. My personal opinion. Others may disagree with that. But when it comes to this image, if this was any other disease, that would be a DNA helix, right? We would show a DNA helix. But with obesity, we got to show that belly. Let's pinch that fat. That's how we do it. It's always that way. And I'm not making this up. This just isn't my own preferences. They actually studied this. This is Rebecca Poole's group out of the Rudd Center who did this work. They actually took online news articles and actually studied the images associated with them. And they basically said, well, if the person has overweight or obesity, what their characteristics were, and if they were normal weight or so-called non-overweight, what their characteristics were. And you can see that 59% of the time, if the person in the picture was overweight or had obesity, they were shown without a head. If they were normal weight, it was only 6% of the time. And then if you flip it to more positive characteristics, if they were overweight, they only were dressed professionally 11% of the time. But if they were normal weight, so-called normal weight, 50% of the time. So you see the media is subtly reinforcing this. And now one of the arguments is, well, they just use the images that are available in the image banks. And actually one of the things we've done to combat this, and I'll show you the slide and give you access to it later on, is actually create an image bank where they don't have to use these kind of images. This is the same data for videos. We won't spend a lot of time on it, but you can see it's a little harder to cut someone's head off in a video. It's actually considered bad videography, so you see that data there. But the trends follow almost exactly in the same way. And here's the summary of that data, if this will advance. Sorry. There we go. 72% of images were stigmatizing, according to the Rudd Center. 65% of videos were stigmatizing. Stigmatizing images make public attitudes worse. Non-stigmatizing images improve attitudes towards obesity. And guess what? The public's getting tired of it, right? We prefer non-stigmatizing images. 72 or 73% of us in this country now are overweight or we have obesity. And we're tired of it. You see this backlash happening right now with fat shaming. Like people are really pointing out fat shaming now more than ever. Of course, usually it's someone who's a size 0 or 2 who's become a size 2 or a size 4. But the reality is we are seeing people to say, let's push back against shaming people for their body size, especially in imagery and in the news media. Since we're at a meeting on food, I picked we find this in political cartoons. This is what reality, we don't have a pyramid anymore. Obviously, it's gone for a long time now. But I just wanted to show it to you that it exists everywhere, right? Even in political cartoons, we can pick out one a week probably that make fun of people with obesity. It's in our politics. So this is pictures of Governor Chris Christie, who at the time was deemed to be too fat to run for president of the United States. By the way, this is not a left or a right issue. When Regina Benjamin, who was one of President Obama's Surgeon Generals, was nominated for Surgeon General, many people opposed her nomination because they said she was too fat. And they came and they said, well, how can someone who has obesity be in charge of our country's health and trying to address obesity? And my response was, who better? Because we know actually everything we've done so far hasn't worked at all. Unfortunately, Dr. Benjamin didn't take on obesity as Surgeon General, or a short time as Surgeon General, but now I actually saw her lecture not long ago, and she is actually taking this topic on, so I'm excited about to see what comes out of that. It's also entered into our presidency already, right? And just to be cautious talking about our own president, but people criticized him a little over a year ago when his medical records were released and his BMI was 29.9. The hashtag went around on Twitter calling it the girther movement. Obviously a play off the birther movement that was under the Obama administration. And it was interesting for me because I had to issue a statement saying, hey, let's stop shaming the President of the United States about his weight. Now, people criticized me for doing that because they said, well, he's shamed other people because of their weight. And I said, shaming the shamer is not the solution, right? We have to work on being able to address this issue. By the way, I don't think my message got completely through because they did release his medical records again not long ago. His BMI now puts him in the obesity category. I'm not a fan of BMI. We can have that conversation later on if you want to. But and then, of course, the hashtag changed to Mira Lardass, and they were making fun of him as a picture of him eating at the buffet at his property in Florida. So we have much work to do. I will tell you right now that one's ability as a politician has nothing to do with their body weight. And by the way, they've actually done some studies to look at our Democrats and Republicans, which one have higher body weights, and guess what? We're all affected by obesity equally, right? It doesn't matter your political affiliation when it comes to obesity. I put this one up here because I think the one thing about Chris Christie's story, which I started off with, was Chris Christie has been an interesting case. First of all, he's pushed back on some insults. So in this one, David Letterman actually named him Father of the Year because Chris Christie is fat, and father starts with fat. He pushed back and he said, I'm really going to miss you. This is when David Letterman was retiring and Stephen Colbert took over. The other thing about Chris Christie was very public with his struggle with obesity. And unlike most people who keep it a secret that they actually sought help, Chris Christie actually had bariatric surgery, lost about 100 pounds. Chris Christie had very severe obesity. And you know what? For the first time I can remember, no one stood up and said Chris Christie shouldn't have had that done. Right? It was something that people had saw him struggle quite publicly and actually said, you know what, that was someone who needed to have surgery and needed the help that the medical system could offer. The reality is there's a lot more people like Chris Christie. There's lots of us, and not all of us have as severe obesity as he does, and we need help too. And so, but I'm hopeful that his story and his willingness to come forward with it will actually benefit other people in the long run. He hasn't taken the issue on publicly himself, but I think just the example that he's set for people is an important one and worthy of some praise, no matter what your political views on his views are. This is a real ad. I just want to tell you that this is what we live with, right? So you're a gym owner and you decide this is a good idea. You only make money if people come to your gym. And I will tell you that this is the reality we live in. And by the way, there are Facebook pages and Instagram pages that take pictures of larger men and larger women at the gym and make fun of them. And this is the reality we face. Why do we make fun of people when they're trying to go better their health? But in our society, again, obesity is bad, and so are the people with obesity. And we've got to change that, because we don't make fun of an alcoholic going to an AA meeting. We would never do that. Yet we make fun of people with obesity when they try to better their health, when they try to seek help. We'll talk a little bit about the workplace. I won't belabor this a long period of time. Almost all of you have probably seen this. You take probably on one of those TV specials, they take a person, they send them in for a job interview with their resume. They send them back in later on in the same day in what they call an empathy suit. I don't think you can develop empathy in an hour of wearing a suit, so I call it a fat suit. You actually send them in the fat suit, and guess what? The skinny person always gets hired, right? I mean, that's the reality of what we live in today. There's a lot of bias from employers, and you see all the other challenges that the science says that there really is a big issue in the employment realm, and you see that candidates with obesity are less likely to be hired, ranked as less qualified, are paid less, we'll talk more about that in a minute, and expected to be less successful. When it comes to pay, women with obesity earn about 15% less than their normal weight counterparts. Gentlemen, remember I told you earlier we're not affected nearly as much? Comes with wages as well. And in fact, if you're a male of Latino descent, you likely earn more money if you have obesity than if you are normal weight. It's what the data says, so I'm just going to tell you what the data says, and we'll just continue to look at that, but we'll see how that progresses over time. You know, this slide's really important, especially if you are part of a company that offers an employee wellness program, and one of the things you're thinking about doing is actually penalizing your employees for having a higher body weight. Now think about that. The women in your company are already penalized about 15% unintentionally, right? The society says it's okay to pay them less. But then you're going to penalize them again by charging them more for their insurance. You're taking the money out of their hands that they could use to get their care. And actually, if you paid these women and actually the appropriate salary, the equal salaries, would they actually have the resources available to get the care and the help they need to address their obesity? So it's very important to understand this data, and it's powerful data and this is one area that needs to change. Again, it's not illegal because we do not have laws except in the state of Michigan for discriminating against people with obesity. Here's more data on discrimination. We won't belabor this, but these are actually reports now, so not documented cases of workplace discrimination as well. And then let's go to the area where many of us work, which is healthcare. So bias is rampant in healthcare. And one of the realities of why bias is rampant in healthcare is that our healthcare providers don't receive much training on obesity at all, if any training at all, in their training programs. And you see it in all the different areas listed here. And how are patients viewed? Do you remember that list of things we saw from the media, how they describe people with obesity? It almost matches this one perfectly, right? Lazy, undisciplined, unsuccessful, unintelligent, dishonest. That's how providers report people with obesity. Now, I don't mean to be overly harsh on you, those of you that are providers. Some of you probably provide great care, but the reality is not all of your colleagues do. But I also understand your frustrations as a provider. For a long time, we did not have this more advanced understanding of obesity that we heard just this weekend here from Dr. Lustig and others, right? We thought this was a simple problem of just telling your patients to eat less and move more, and it's not. And so you got frustrated, and maybe you adopted some of these views, but it's time for those views to change. And it's time for us to have this more comprehensive view of obesity, understanding that it really is a complex problem. And actually, one of the best ways to reduce bias, if you meet someone who really is basically engaging in bias all the time, is actually just to convince them that obesity is complex. Once you convince them it's complex, it's less likely they're going to engage in bias. If they think it's a simple problem, it's really easy to blame the patient. Picking on physicians again for a minute. Physicians' attitudes, you see them all there. The one that stood out to me the most is less desire to help the patient. Again, that might be based on that frustration. We look at nurses. I'll pick on you as well. 24% of nurses reported that patients with obesity repulsed them. Think of all the things that a nurse can see in a day, and it's obesity that repulses them. Again, older data. The reality is I think times are changing. Many nurses have attitudes about people with obesity because they got injured moving someone of a larger body size, right? And nurses in the room, many of you may have been in that experience before. Now we have better equipment. We have better training on how to use that equipment. This should happen less. Hopefully attitudes will improve in this group, because we also find that nurses, especially nurse practitioners, are some of the biggest champions to getting people help for their obesity as well. So we've got to work this from both sides, because We know there are champions, but we also know there's some bad attitudes in that group as well. Where can we meet in the middle to make sure we provide the best care possible? So what happens if you are mistreated by your healthcare provider? Obviously, you're upset. You usually shut down. Most of us, our visits are really short. I'll actually show you the data of that in a minute. When you have obesity, you kind of shut down because you don't want to deal with the issue before that you want to. You perceive that you won't be taken seriously, and you actually report that your weight is blamed for all your problems. And a good friend of mine, Ted Kyle, we do a lot of research together. He often says this. He goes, I could walk into my doctor's office with an axe sticking out of my forehead, and the doctor would tell me my head hurts because I'm fat. Right? And the reality is that, I mean, obviously that's an exaggeration, but it is often the complaint that we hear. And this really does make those of us who live with obesity really reluctant to address our weight concerns. And by the way, if you're a parent of a child with obesity, this is a particularly difficult struggle. We have millions of children in this country that have obesity and then have severe obesity. And we only have probably 40 places in this country where there's adequate treatment for them. And this is something that I spend a lot of time working on as well. And I appreciate the last administration's, Mrs. Obama's work around childhood obesity. I was there when it was kicked off. I was in her office many times trying to do this. But the fact is that they left office with still us only having 40 places in this country to treat those millions of children is the biggest disappointment in that Let's Move program. They did a lot of things to change things in the long run for future kids, but they didn't help the kids that live with obesity now. And that's what we really need to do, because otherwise we're going to have a really, really sick next generation. And then, by the way, they're going to pass that on to their children as well because of the epigenetics and other issues around obesity. Here are some patient examples. I'm glad to report that we see less of these stories of bias coming from providers' offices, but I'll pick the last one just as a simple example to talk about. Once when I was going to have surgery, I had to be taken to the basement of the hospital to be weighed on the freight scales. I've never forgotten the humiliation. So I actually don't blame probably the nurse anesthesiologist who took the patient down to weigh them, because that patient needed to have surgery that day, and they did what was needed to get it done. But I blame the institution for not having the right kind of equipment, not the right kind of training, nor the person who scheduled the surgery in the first place for not sending them to the right kind of facility. There are 1,000 programs in this country that do bariatric surgery. All of them have to have this equipment. There is a bariatric hospital somewhere nearby where this should never, ever happen. By the way, I have scales that I take to trade shows when Obesity Action Coalition does trade shows. I bought them on Amazon.com. They were $60. They weigh up to 750 pounds, right? There's no excuse from an economic standpoint to have this way as well. 10% of women are 100 pounds or more overweight in this country. 5.5% of men. So high body weight is very, very normal. You need to have the right kind of equipment. I mentioned this earlier, but quality of care really is affected. If you're a person with obesity, on average, you spend less time in your doctor's appointment than someone who does not have obesity. So think about that. All the complications associated with obesity and the other conditions associated with it, you spend less time. But here's how it goes. I'm reluctant to bring it up. You as a provider may not want to bring it up because your schedule's really tight today. The conversation never happens. It's great you kept your schedule, but that's another year likely before you see me again where we haven't addressed this issue. And you heard Dr. Lustig say it earlier today as well. You know, the longer we wait, the harder it gets to treat this condition. We have to get to people early. We have to overcome this. It's important. And patients with obesity, this spending less time goes to other areas as well, some of them truly tragic, and that's when patients actually don't seek the preventative health services they need because of past bad experiences. I've received so many letters from families in my office of people who, for example, died of a OBGYN-related cancer because they had a bad experience at one point and never returned, and the family member passes away. People, and the documentation is very strong, people with obesity are more likely to delay their preventative care services or cancel their appointments because they're worried about being stigmatized. And if any of those kind of the emotional I appeal made so far doesn't play to your particular views, I just throw this slide up as well. And that is, what does it do to your practice if you don't treat people with obesity with dignity and respect? And look at those last two bullets. About 40% of people are walking away. So most of you work in a volume-based system, right? You have to have the volume to stay in business. 40% of your patients aren't coming back. You're losing volume. You've got to address this issue of bias and stigma. So this is Rebecca Poole's cycle of bias and stigma. And in our country right now, we have about 40% of people with obesity. And as I mentioned earlier, about 10% of women have severe obesity. And that number is growing dramatically. And one of Rebecca's hypotheses is that people have obesity and they face the health consequences. They go to the doctor more often. They face this bias in healthcare. They develop these really negative feelings. They avoid healthcare. Their behaviors get worse. They have this poor self-care, and they get caught in this cycle. And so one of the reasons why she believes that the severe obesity rate is growing so much is because of bias. It's not the only reason, but you see people getting caught up in this cycle of gaining more and more weight because that's how they're reacting to the bias that they face. And I'll show you some other information about people gaining weight because of bias in a few minutes. So there are real consequences of biases. We've talked about some of these already. I've covered most of the work ones on the slide here. I just will mention the school ones as well. Many of you who have school-age children have had bullying materials come home. I think unless you live in a really enlightened school district, those bullying materials do not mention weight-based bullying. Weight-based bullying is the original form of bullying. There have been more suicides and harm caused by weight-based bullying than all the other forms of bullying combined. Yet it is so ingrained it's okay in our culture that it's likely not in those materials that have come home. If your school district did include it, you should applaud them, and if they didn't, you should call them out on it, because it's a small way that you can make a difference in the lives of children living with obesity. I'll spend a second on this slide because it is the one that was most impactful to me, and I'll tell you a personal story. So when I was 11 years old, my uncle died from his obesity. He actually was in a brownstone apartment in New York City, had a heart attack. First team got there, said minor heart attack, no big deal, we'll get him to the hospital. And then they realized how big he was. He was almost 500 pounds. And they had to wait for a second team to get there, and he died as they were waiting for the second team to get there. So I was 11 when that happened. And my dad was nearly the same size as my uncle. And I will be honest with you, from that point forward, from 11 until my adulthood, I gave my dad grief about his weight. And it wasn't because I was just this evil bastard child, right? It was that I thought he was going to die. And I thought this was the way to motivate him to do something. And he always responded to me, he goes, I know, Joe, and I'm working at it. Someday you'll understand, was always his response to me. He always handled it really well, at least outwardly. Internally would be something different. And then I started my work, and of course I became an adult. I started struggling with obesity myself, and my family were all rail thin as kids, and then we all get big, and 450 pounds is probably the norm in my family. And then I started doing this work on bias, and then I started thinking about my own work and my own experiences, and I realized that, I likely contributed to his struggles with my attitudes, because the data is very, very clear. If you give someone a hard time or you make fun of them because of their weight, they are not going to lose weight. They are going to gain weight, because people binge eat when they have those experiences, and they cope with stigma by eating more food. So this was, when I saw this, I was hurting inside, but luckily my dad is still living, and so I had the conversation with him about it. And it was an interesting one, because he just completely said, Joe, it wasn't a big deal. I knew I had the problem, and it's something I've always struggled with, and I was used to it. But then curiously, shortly afterwards there, he actually been able to start opening up with me about his own struggles. And it did change our relationship, right? And he actually told me his actual body weight, which was something that never got talked about publicly. And actually now I'm working with him. He needs a knee replacement, and of course he's being denied that knee replacement because of his body size, and we're working together to try to make that happen. So I just find if you see yourself in being someone who stigmatized someone before, there's probably still an opportunity to say, hey, I've got a little better knowledge now. We think about obesity a lot differently than we did all those years ago. Let's talk about that again, and maybe offer an apology if appropriate. Here's the data, by the way, on when women especially turn to food. Just wanted to show you, just make sure you have the reference in the slide deck there. There are, one of the other interesting things about bias is that it doesn't necessarily go away when you lose your weight. So the interesting data from bariatric surgery is that we find that, okay, yes, people who have bariatric surgery before them when they had obesity, they were stigmatized. And then they have bariatric surgery and they usually lose about 10 BMI points, about 100 pounds on average, maintained about 5 years. And So the thought would be is, of course, their bias levels would go down, their stigma they face would go down. But the actual data suggests that people perceive that as taking the easy way out and actually not being able to do it on their own. And so therefore, their bias does not, the rate of bias they face does not go down. So this is something we have to acknowledge, right? And especially if you're counseling bariatric patients or you have bariatric patients who come through your practice, it's important to talk to them and make sure that they're coping with these stigma issues appropriately. One of the things we do see with bariatric surgery patients is a higher rate of suicide many years post-bariatric surgery. And I think a lot of it has to deal with some of these issues around stigma that they faced and thought it would disappear, and it hasn't. Also going to deal with some of those depression issues and other things we talked about this morning. So I would leave you just with a few thoughts and a few ideas. One is just to look at your own attitudes. Ask yourself, are you making assumptions about someone based on their body size? There are people who are 400 pounds who have no health complications from their obesity. And by the way, there are people, as Dr. Lustig showed with some of the data, that have BMIs of 22 and 23 that have all the same complications as a person with obesity typically is perceived of having. So try not to have those stereotypes and try to be sensitive to the needs of people with obesity as you move forward. Get the facts. I've yet to meet someone who struggles with their weight who hasn't tried to lose weight at some point in their life. It might have been for a day or an hour, but people have tried. And people have also likely been stigmatized by their healthcare professionals and their family, which we didn't spend a lot of time talking about family right now, but it's often the main source of stigma. Obesity is awfully complicated. We started to hear about all the science yesterday from Dr. Lustig. It's not just about personal responsibility. That doesn't mean you don't have to deal with the hand of cards you've been dealt in life, but it's more than just personal responsibility. We have to deal with these environmental issues. We have to deal with the societal issues to be able to address this. Use the right kind of language. You will notice that I do not use the word obese, and I would challenge you to take that word out of your own vocabulary. We don't say people are cancerous, okay? We don't actually use the word diabetic anymore. We now say people with diabetes, okay? So we've adopted this language where you are not your condition, and so I think it's really important that you try to do that as well. So take a look at your own materials, and if you see the word obese in it, start striking them out. I know it's awfully hard because sometimes they're in references. In fact, the word obese appears in my slides one time because that's what the reference says, right? But the reality is, if you can try to take it out of your vocabulary, it is a good thing. Just talk about your higher BMI patients when you're talking to them directly anyway. And then if you actually diagnose them with obesity, then explain what that diagnosis really means and use the right kind of language. Really think about what kind of materials you use. We don't need to further stigmatize people in any kind of educational materials. These are all real campaigns that have appeared across the country, and I think these actually do more harm than good. We need to address obesity. We need to do it in a more serious way, not a blaming way. Obesity is not smoking. Okay, you do not have to smoke to live. All of us have to eat every single day to live, or at least within a couple days to live. And stigmatizing campaigns don't work. When we actually studied them, and those are real campaigns, by the way, childhood obesity is child abuse kind of thing, and fat kids become fat adults. These had the lowest intention to comply. So if you actually put up a campaign and you're trying to change public attitudes and the data shows you had the lowest intention, people's lowest intention to comply, then you failed, right? Move on to something else, move on to a different kind of campaign. As I mentioned earlier, here's the resource for the imagery. If you need the right kind of imagery, you can tap the OAC website. This slide deck is in your materials, so you'll be able to access it there. It's all free, as long as you're not using it for commercial purposes, any of your presentations, things like that. Feel free to use the images, your newsletters, whatever it may be. Think about your weighing procedures. Think about asking people's permission to weigh them. And make sure you try to have a private location. The hardest thing for me with my primary care is I'm weighed in the hallway in front of everybody. And there's times my weight gets yelled down the hallway, and it's private information, right? Let's just be sensitive about it. This is common sense, but the reality is, and we're cramming medical offices in all kinds of places these days, space constraints, things like that. Sometimes common sense gets lost in those kind of activities. Think about your own practice, what you have about seating, reading materials, ramps, handrails, scales, bathrooms. You just need to be accommodating to people of all shapes and sizes. Chairs are a big thing. Anyone is like me and you've ever broken a chair before, it is the most embarrassing thing you can do. And you don't want a patient to break a chair in your office, so make sure you have the right kind of seating available, or at least some wider seating so that people can be accommodated. Here's my cheat sheet of what to do and what not to do. No headless images, please. We all have a head. Let us have a head, please. That would be my one thing. Let's watch the jokes, okay? I wish someday, I like to joke around. I wish we could joke about this someday. We're not there right now because of all the stigma and actual discrimination taking place. So please, it's not okay to give a fat joke anymore. What to do, just be realistic. Treat people appropriately. Treat them how you want to be treated, right, with imagery and things of that nature. And promote those healthy behaviors, which I know are such a big part of this meeting, and I'm proud to be part of it because of that. How do you advocate against bias? You use that language, use it appropriately, and challenge bias when you see it. You see someone being mistreated because of their weight, say something, right? It's, see something, say something. That's from the TSA. You're in your airport. Many of you going home, you're going to hear that. I'm stealing it, right? We're going to use that for weight bias as well. If you see something, say something. It's the only way we're going to do this. We're going to change this one person at a time. Because there is this cultural value of thinness in this country that's going to be hard to overcome. It's going to take basically a swell of people, a wave of people to be able to change attitudes. Think about your own workplace. See what you can do better within your own workplace to care for people with obesity. And of course, show dignity and respect to a person no matter their size. So here's my summary. Bias is prevalent. It's pervasive. It has really significant harms, and it really holds us back. And it's only together that we're going to be able to tackle this. And I think when we do, we can finally see that curve of obesity, or the line of obesity, which continues to grow every year. And in fact, no country has ever decreased their obesity rate year over year in any wide group of people. In fact, there was a data report just this week that said, 2 to 4-year-olds, their obesity rates went down in the US when they were on WIC. But if actually you looked at 2 to 5-year-olds, the rate went up. So it's just how they cut the data. So it just becomes, we have to be very, very careful about how we do this, right? But the only way we're going to make that curve go down is actually if we start treating people with a little more dignity and respect, treating obesity as the complex problem that it is. And then finally, hopefully, we can actually bend the curve and improve the lives of people living with obesity. So thank you very much. I'm happy to take any questions from the audience.